Hello everyone and welcome to NextGenGP. If you are preparing for the RACGP, CCE or the AMC Clinical Exam, this short video may significantly increase your chances of passing. Many candidates fail not because they lack knowledge, but because they don't demonstrate safe, structured consulting. Today I'll show you 5 strategies that examiners are actually looking for in every station. One of the biggest mistakes candidates make is that they jump straight to the diagnosis. Examiners are not just assessing your medical knowledge, they're assessing how safely you consult. Common reasons that candidates can fail is because they lack structure in their history, they don't focus on the red flags, they miss some of them, they don't assess mental health in some of the consults where a physical health complaint or organic disease is present. They also have weak explanations in their counselling and management stations, and they don't offer any safety netting to the patient. To stay structured in every station, I recommend using the GOLD framework. Greet your patient and ensure that you build rapport with them, that you have an open history. You start off every history with an open-ended question, and you try to explore the patient's ideas, concerns, and expectations, and tailor the consult to the patient and their agenda. You also look for the red flags that may be present for each presenting complaint, and you decide on what the most likely diagnosis is, and you manage the patient accordingly. If you follow the structure, you will look organized, safe, and confident, and that's what examiners love. One thing that significantly improves your score is screening for psychosocial issues. In many RACGP and AMC stations, candidates will lose marks because they simply forget to screen for mood issues, sleep disturbances, stresses, and they don't focus on what potential substances the patient may be using, and also the presence of any suicidal thoughts or thoughts of self-harm. Even in physical presentations, mental health screening shows holistic care. So don't forget to screen for mental health. It can be a very quick question that can save you a lot of stress. Examiners expect you to actively look for dangerous diagnoses. Some common red flags include constitutional symptoms, fevers, weight loss, night sweats, as well as neurological deficits, arm or leg weakness, sepsis symptoms, domestic violence, as well as suicidal ideation. When you ask these questions, you demonstrate safe medical practice. In exams, management should be clear and structured and use the simple formula of explaining what the most likely diagnosis is and why, discussing potential investigations as well as treatment options, and always providing safety netting, giving the red flags, and following up. If you do this, examiners can clearly see your clinical reasoning. Safety netting is one of the highest scoring behaviours in clinical exams, so always tell the patient what to look out for, when to return for medical care, and how urgently to seek urgent care, what symptoms to be watching out for specifically, and when follow-up will occur. In the RACGP, CCE and AMC clinical exams, examiners are assessing your overall communication skills, your clinical reasoning, as well as your ability to assess risk, and having holistic patient-centered care and offering the patient a management plan that is tailored to them. It's not about knowing everything, it's about showing safe GP thinking. If you remember only one thing from this video, structure every consultation and always ask for the risk that may be present in a particular case and explain your rationale clearly, and always safety net every patient every single time for every station, and also for every consult for your real life practice. If you found this video helpful, please subscribe to the NextGenGP channel. I'll be releasing more RACGP and AMC clinical exam strategies and mock cases to help international medical graduates succeed.